Today, I will demonstrate 12 exercises for people with ankylosing spondylitis. Ankylosing spondylitis, or AS, is an autoimmune disease, which means that the person produces antibodies that attack their collagen, and it affects the spine and sacroiliac joint, causing fusion of the bones and loss of mobility. They have pain and stiff spine that looks like this. Exercises are helpful to reduce the stiffness and prevent that the bones become fused. Exercise also helps to reduce the symptoms, including pain, fatigue, balance problems, and lack of flexibility. Exercises are an excellent way to open the inner pharmacy inside our brain, and that will help us to feel better, to sleep better, to feel happier and more motivated. Exercises also help you to control your blood pressure, blood sugars, weight, and energy levels. So, let's start our exercises for ankylosing spondylitis. If you want to learn more about ankylosing spondylitis, watch my other video here. I explain what ankylosing spondylitis is, why doctors often miss this diagnosis, how the doctors diagnose this condition, and how to treat it with medications that are specifically targeted to ankylosing spondylitis. And please remember that this video is not intended to provide medical advice. If you have a condition that is causing pain, please talk to your doctor to get an appropriate diagnosis. This video is for educational purposes only, and if there is an emergency, please go to the nearest emergency department or call an ambulance. Our first exercise will start in bed, because most people with ankylosing spondylitis wake up with morning stiffness, pain in their spine, in the sacroiliac joint. And doing these exercises in bed is very helpful, because then you will be lubricating those joints, the spine and the SI joint, before you even get up. So the first exercise is the knee to chest. And this list of exercises, I'll put a link in the description of this video below, and you can download this document and follow this exercise. So knee to chest. So what we need to do is mobilize the SI joint, the spine. We're going to bring the knee to our chest. Bring this slowly here. Do it with the other side. You bring the other one. And then you can bring both knees to the chest. Relax. Remember to breathe. So when you're doing this, you can stretch. And you'll be stretching all of these muscles here, because they had been not moving during the night, and they might be hurting. So knee to chest. If you want, you can pull here on the top of the knee, but I prefer if you pull here below the knee, because then you don't put a lot of pressure on the knee. So pull it here. When you are bringing the knee to chest, you can bring to the same side shoulder, and you can also pull a little bit to the opposite shoulder. So knee to chest, and now you bring to the opposite shoulder. Do the same thing with the other one. Pull your knee towards the same side shoulder, and then you can bring to the opposite side. So you will feel stretching all of these muscles here, and stretching and opening the SI joint, closing. So this is good. So this is knee to chest. The second exercise is the pelvic twist. And the pelvic twist, I will show you two methods of doing this. One is the beginner, and the other one is for advanced methods. So the beginner, all you need to do is bend your hips here, bend your knees, and just, you can move your body to one side, and your hip and legs and knees to the other side. So your body goes to one side, and your hips, knees goes to the opposite side. So you're twisting. This is good because you will be moving those joints, the small facet joints in your lumbar spine. You'll also be moving the sacroiliac joint, the hips, but mostly the lumbar spine, the rotation. So this is the beginner. If you never did this, you can start doing this in bed, before you get up, in the morning. So this is the beginner twist of the lumbar spine. The advanced method of this is a little bit more difficult, but you can do if you practice. So what you're going to do is you're going to put the one foot to the other side of your knee. So just cross here. And when you do this, you're going to pull this side here. So with your hand, you're going to pull this knee to touch the bed here, keeping your shoulder and the other arm here. So you see you're twisting and keep it there. Breathe. Come back. So now you're going to do with the other side. So this leg straight, the knee straight. Cross your foot to the other side. This hand pulls here. This hand stays in the bed. And you're going to pull, 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 pull. So your knee can touch here. Okay, so this is a little bit more advanced. You're also stretching the piriformis muscle and all the sacroiliac joint here. And if you want, you can even drop your leg outside of the bed to pull even more the piriformis muscle, the gluteus minimus muscle. And just breathe and let your muscles relax. And you can do this in the morning. The more repetitions you do for each side, the better. So now we are going to do the exercise number 3. And the exercise number 3, you need a mat. So the exercise 3 is the bridge. And the bridge is quite simple. You find, you get a mat, and all you do is just bend your hip, bend your knees, and just raise your hips, your pelvis, hold it there. You can hold for 10, 15, 20, 30 seconds. The more you hold, the better. So when you are in this position, contract your glutes, your abdominals, relax your hands here and breathe. Just keep breathing, counting as many as you can, as long as you can. That's the bridge exercise. That's great to strengthen your muscles, but also to move these joints here. The exercise 4 is the dead bug. So dead bug is, you use the mat on your back. What you're going to do is just raise your arms, your legs, and you're going to move opposite arm and with the opposite leg. So the right hand comes up and you move the left arm, right leg, and now right arm, left leg. Your leg, your foot does not touch the ground, okay? And when you do this, try to touch the mat, your lumbar spine here. Try to feel all the bones of your lumbar spine touching the mat. If you can't, if your lumbar spine does this, that's fine, but try to touch them. Try to keep your lumbar spine like this. This is more like an exercise for your sacroiliac joint. Okay? So, 1, 2, 3, 4, 5, and then you keep it going. You keep counting, and each day you can increase a little bit more how many repetitions you can do of this. I remember in the beginning when I started doing this, I couldn't do more than 5 or 6. Now I can get to 60, 50, 60, and that's when I start getting tired. This exercise, I think, is what saved my lower back. when I had a crisis of acute low back pain. When was that? Maybe 8 years ago. I had an acute low back pain, and this exercise saved me because I don't know what I had, but I was very disabled for many weeks, maybe 6 weeks. And after I got better, I started doing these exercises plus many other exercises. I have another video that I talk about this. And I got so much better. And I got better quickly. And also this prevented me from having more low back pain. So I love the dead back. This is an exercise for the muscles inside of your pelvis, including the iliopsoas muscle, abdominals. And as I said in the beginning, it was really hard for me to do, but now I can do without a lot of difficulty. Again, remember when you do this, you don't touch the ground here, okay, you keep it up. The exercise 5 is hamstring stretch. Hamstring stretch is so important for any kind of back pain because hamstrings are these muscles here on the back of our thigh. And we tend to have them very short and tight because we sit, we're always bending our knees, so they tend to be short. And if they are short, they're going to pull the ischial bone here in the pelvis, so it's always good to stretch your hamstrings, even if you don't have ankylosing spondylitis. So here you bend one knee, we're going to stretch this one, so keep this leg straight. You see mine is very short. I know I have to stretch my hamstrings. This is how far I can go. It hurts all the way here. I know my hamstrings are very short, and you can help with your hand. You can pull a little bit and then bring it back. So then the next one here, and do this for both sides. And lower. You can do many repetitions for each side. Here, help with your hand. And here. Again. So do this every day to stretch your hamstrings. The exercise 6 is the Superman. So Superman is very important because people with ankylosing spondylitis, they tend to have rigidity here. So this is an exercise that you're going to strengthen your paraspinal. So let's go, let's fly like the Superman. So you hold up and you hold as many seconds as you can. So in the beginning you can start with maybe 10 seconds, 20, increase to 30, and if you can, hold it for 1 minute. Don't forget to breathe, okay? You're strengthening your paraspinals, which are very important to stabilize your spine. Breathe. While you're holding there, you're contracting the glutes. Okay, so then this is the Superman or exercise number 6. The exercise number 7 is the sloppy push-up. And that is to mobilize the lumbar spine, because we did the flexion of the spine when we were doing the knee to chest in bed. Now we are going to do the opposite. We're going to go backwards with our lumbar spine. So what you do is, the sloppy push-up, you just put your elbows here and hold on this position. You see, so my lumbar spine is doing this curvature now. And now, if you can, I want you to try to go up and up and up and up like this, and maybe even a little bit higher. Hold there. There's a lot of pressure in the lumbar spine. Yes, there is. If you can tolerate this, this is great. If not, you can just start doing here, okay? Just stay here for a few seconds, count to 10. You can even be reading a book. That's why I brought my book here. This is my book, The 8 Steps to Conquer Chronic Pain. So you can distract yourself with this sloppy push-up by reading my book. It's a good way, it's a good use of your time. I hope you like my book, The 8 Steps to Conquer Chronic Pain, A Doctor's Guide to Lifelong Relief. I have a lot of tips here, cases, I have questions and answers. I talk about mind body. I talk about stress. I talk about fear. I talk about medications. I talk about arthritis, motion is lotion. So this book is helpful for anyone who has chronic pain, and if you have ankylosing spondylitis, I recommend this book for you. The exercise 8 is the bird dog, and it has this name because you start here with the dog. The dog stays on the 4 legs and the bird flies. So the bird flies, right arm, left leg up, bring back to the dog. Now left arm, right leg. Keep doing this. You can count to 8, 15, 20 times, or you can do this for a minute. Dog and bird. Raise your leg and stay here. Don't forget to breathe. And your arm. And raise your legs and your arm. And you're moving your lumbar spine, your sacroiliac joints. When you're doing this, you're strengthening the muscles of your back. You're lubricating your joints. So it has a lot of benefits. Many, many benefits doing this for people who have ankylosing spondylitis, but not only this. If you also have low back pain, this exercise is great. This exercise is great if you have low back pain. Exercise 9 is the cat-cow. Yeah, we have a lot of animals in this video of exercises. I like the bugs, I like the bird dog, and now the cat-cow. And this is an exercise, I tuck my shirt in so then you can see my abdomen because that's important. So the cow looks up and the belly of the cow is down. So that's one position. The cow is this, relax here. When you do the cow position, you see my lumbar spine is going down here. Yeah, so that's the cow position. And then when the cat is frightened, what the cat does is the cat will go tuck his head in and his spine up. So this is the cat. So you alternate the cat, tuck your chin in, the chin touching your chest, and your belly button is going up. Belly button up, head down, okay? This is the cat. And breathe. And you alternate this with the cow. Now the cow, the belly button goes down, the head goes up. So the belly goes sagging like this, and you alternate. The cow, put your arms, your hand under your shoulder, your knee under your pelvis, your hip here. This is the position, the cow. Breathe, relax, and now the cat. And you repeat this many times. This is the cat-cow exercise. Exercise 10 is for the neck. The neck can also be affected in ankylosing spondylitis. The whole spine can be neck, thoracic spine, lumbar spine, and the sacroiliac joint. Those are affected in ankylosing spondylitis. So we do need to do exercises for the neck. And in order to avoid that the neck becomes rigid and stiff, you have to do the 6 movements of the neck. What are the 6 movements of the neck? So this is range of motion, flexibility of the neck. The 6 movements are, first one is bending forward. We call this flexion. So bend forward. Try to touch the chin to your chest. So bend forward. That's flexion of the neck. Bring it to neutral. And then the opposite is extension, and that's bending backwards. So try to look at the ceiling. I'm looking at the sky. It's cloudy today here in Toronto. It's warm and nice. Yeah, look backwards. So flexion, extension, 1 and 2. 3 and 4 is lateral bending. So you're going to bring your ear to your shoulder. Of course, I'm not going to touch my ear on my shoulder, but that's the direction you want to go. So keep your spine straight and just bend your neck to one side. Normal is 45 degrees. And now to the other side. Okay, so you're lubricating your joints. You are avoiding that the vertebra in your cervical spine becomes fused if you do this every day. Okay, and 5 and 6. What are the 5th and 6th movements of the neck? It's rotation. So you bring your nose to your shoulder. So here, look at the side. Ideally, your nose will be aligned with your shoulder. And center, and to the other side. And keep it there, breathe. Always remember to breathe. And bring to the center. And you can do this many repetitions, all the 6 movements. You know, you can do this 3 times in the morning, or you can do morning, afternoon, and evening. Even when you are, in the car, you're waiting in line, you are, doing something at home, and you can, I'll do my range of motion exercise for my neck, and you do those 6 movements. Now for exercise 11, you do need to stand up, because exercise 11 is for the rib cage. Ankylosing spondylitis may also cause enthesitis of the joints of a rib cage, and so the person will have rigidity of the bones, the ribs, and some people may develop difficulty breathing and shortness of breath because the rib cage will not expand normally. So in order to avoid this rigidity of the rib cage, you need to do daily exercises. And so how do you open the rib cage and stretch the rib cage? Basically, you have to use air inside of your lungs. So you need to take deep breaths, hold it, and we're going to use the arms to help to open the rib cage, okay? So you're going to take a deep breath and raise your arms and hold the air there. Hold, 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 hold. And now when you breathe out, you lower your arms. So you do this a couple of times, okay? Take a deep breath. So we are moving our rib cage, filling it with air, moving our shoulders, so the muscles will help to bring the rib cage open. And you do this a couple of times. You can start with 8 times, increase to 15, 20, 30 times every day to avoid that the rib cage becomes rigid and stiff. And the last exercise, exercise number 12 of this routine, is range of motion of our lumbar spine. The same thing that we did for the neck, that we did range of motion, all movements for our neck, we are now going to do for the lumbar spine, the same 6 movements. So the lumbar spine has flexion, so you're going to go down, 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 down. You're doing flexion of your lumbar spine, relax your arms. Keep your knees straight. You see I'm very tight here. Come up. So that's exercise movement number 1. Number 2 is extension. We already kind of did this when we were doing the sloppy push-up in the mat. That's what we were doing. We're doing extension of a lumbar spine. So 1 and 2. Then remember what is 3 and 4? It's the same thing as the neck. 3 is lateral bending. Don't go forward, okay? Go on your side, sliding your hand on your thigh and knee and leg. See if you can touch the head of the fibula. You see we have a bone here called fibula, and it has a prominence here. You can touch the bone. So when you go on your side, ideally you would be touching the head of the fibula. You can, with your middle finger, you can feel this bone here. Come back to the middle, and then now go to the other side. Again, try to touch the head of the fibula here. And 5 and 6, remember what is 5 and 6? We're going to do rotation. So you go backwards and look behind you, and now to the other side. And look behind you, so you're doing rotation of all those muscles, and that's it. That is for our routine. If you like these exercises, don't forget to give a thumbs up on this video here. And if you're not a subscriber of this channel, please subscribe. I have lots of videos for back pain, neck pain, and many other things for people who have chronic pain. And don't forget to turn on the notifications button there, because then you'll be notified every time that I post a new video on this channel. Thank you for watching today. Goodbye.